My name is Amanda Mitchell. I have a Master's of Public Health. I'm the Executive Director of Epilepsy Alliance Louisiana. But a lot of times I come here as my most important job as a mom of a kid with epilepsy. So I have lived through a lot of these challenges. And these are some things that I did even before kind of joining in a professional role to help our family. So the first thing we want to remember is that we don't have to do this all alone. We were never meant to, as not even as just parents of kids with epilepsy, but just as parents and as moms. We're often expected to do it alone, and it can be really hard to ask for help. Sometimes we don't even know who to ask for help. So that's part of what we're doing today, is looking for who we can ask for help. And so one of my first recommendations is to try and get local help. So Epilepsy Alliance America has 15 members across the country. And so you can see them listed here on this map. And I know we're adding even new members as we go on. If you are joining us from somewhere that does not have one of these local organizations, you can call our Epilepsy Information Service line, and the number is listed on the slide. Or if you're in one of those states, be sure to type in epilepsy support and the state of your name and the name of your state into Google and see, what you can come up with. Maybe there are more things than you're aware of. And so the next thing that I think is really important is to become an advocate. So I love this quote on the side. It is, "Diversity is a fact, equity is a choice, inclusion is an action, and belonging is an outcome." Your children, our children, have the right to be included in school. So there shouldn't be any hesitation or shame in doing that and becoming an advocate for them. Caitlin mentioned a lot about IEPs and 504s, but just to give you a kind of different view, there are two laws, the Individuals with Disabilities Education Act and the Free Appropriate Public Education law, and those are the laws that protect us. So we do have protection for our kids with disabilities in schools. And oftentimes you can go through the 504 and the IEP process and you do not agree with what the school has done. And if that happens, you have two options. You can again look for that local support. So I know exactly what I would recommend to do if you were living in Louisiana and that happened. But since I knew people would be joining us from across the country, I went ahead and tried to find a national resource. So if you go to the website that's listed in there in blue, the .gov one, you can actually search by state. And what you're looking for is to search by state and then look for state agency and your special education agency. I did a couple of test runs on different states, and it wasn't always easy to find, but almost every single one had a search bar. So type in the word dispute and it will come up, and then it will tell you how to dispute anything you don't agree with that may happen in public schools. The other thing to be aware of is that 19 states have passed laws specifically to protect children with epilepsy and seizures. Louisiana is one of those states. I don't have a list of all 19, but if you're interested in learning more, or if you know that you think your state does not have these laws and you would like to see that happen, please go ahead and join on Facebook, the National Epilepsy Advocates for Seizure Safe Schools. This was started by a group of moms, including one, her name is Colleen. And I worked with Colleen to help pass this law in Louisiana, and we are already seeing the benefits to families. So just however you can, in whatever way you can, to remember to be an advocate for your kid. And so the last thing I wanted to do is just go over my checklist. So those are my two kids right there on the side. That's what our pictures typically look like. Lots of chaos and lots of fun. So my youngest son is the one with epilepsy, and he just started kindergarten. So to start to prepare for kindergarten, we started to practice new skills that I knew that would be important for that. So for instance, opening his lunchbox and opening snacks. In our house, we have all the social stories, all the feeling books, which I love, kind of relates back to Caitlin's talk about, the psychosocial issues and depression. So talking about feelings is something we do in our family to make sure that our kids can name their emotions. The other thing we did is, in addition to having the entire school trained in seizure first aid and safety, I also did individual training with his teachers. So with each of his teachers, I reviewed the seizure action plan. I brought real videos. So Jack does have a variety of seizures, and I wanted to make sure that they were going to be able to identify what his seizures look like so that it would be easier for them to respond. And then I also provided them with books about kids with epilepsy and kids with disabilities in general. So these are children's books, and they are going to read them to the class with the hope of being to help the class understand that, again, people are different and what that looks like. For Jack specifically, the other thing we did was we asked for an early visit to the classroom. Kind of that, again, Caitlin mentioned it, the sense of kind of really having trouble seeing all the things in space and really getting overwhelmed. So we felt it would be really helpful for him to just see the classroom without any of the other kids present. And so we did. He met all of his teachers, and they were able to go over some really simple stuff with him that he would need to do there. We also set up the My ID. I'll go over that in a little bit more in the next slide, but it is a way for his teachers, or if they need to call emergency services, to basically have a list of his medications. For Jack, we also made a visual schedule. We found this to be really helpful when he's learning new skills. And so we took pictures of the teachers, we took pictures of the classroom, the playground, and then we're really able to discuss better what's happened at school because I'm able to take the pictures up at home and talk to them individually. The other thing that I like to remind people is, if your school has a pickup list, include anyone and everyone you want on that list. So our family lives about 2 hours away from us. If something were to happen and we need a family member to pick up our other son, we wanted to make sure that someone else could pick him up as well. So we do have friends in our town who can pick up our other child if Jack were to have an emergency. We reviewed our after-school therapies and our activity schedule just to make sure that all of it fits, right? This could be a job in its own, trying to plan all of those things. And this is something I put on there as a reminder for me to always do it earlier than I think I should, because it takes a bit of time. And the last thing I did was actually to prepare his older brother's teachers. So we know that siblings get left out of this conversation a lot, and they're impacted. They see it, they understand it, they have a lot of fears and anxiety around it. So I just had a really quick conversation with his brother's teachers about some really proactive ways to help him. One of the things that we use in our house is that it's really important to be kind, but it's the grown-up's responsibility to take care of seizures. And then that way we're not putting that responsibility, even though oftentimes it's felt, right, and it's a perceived responsibility, but we want to make sure that we're able to address it in a really kind way for the kids. So that's our list. And I know, I have a kindergartner. Your kids may be a variety of ages, but hopefully this kind of helps you to think about what you can add to your list. So I did want to go back to that My ID program, because Epilepsy Alliance America does have a coupon right now for $35 to get one. So if you go on their website, you can get a coupon for $35 off. And what it'll help you to do is to get one of these products. You can see they have the one on the watch band. On the back of it, it has a QR code. And so if your child does need to be seen through emergency services, then they can actually take their camera and take a picture and then pull up medical history. So it'll have medications, it'll have any allergies to both medications and foods. If there are additional conditions other than epilepsy, you can list them there as well. So this makes me feel a lot more comfortable that if something does happen and we aren't able to get there to the school before EMS arrives, that they'll be able to have that updated information. I've done it, it's really easy to set up, so I definitely recommend going look through it. And then our last thing is just to remember that we do have resources available for you. So Epilepsy Alliance America has the back to school checklist, the seizure action plan, the rescue medication videos, the trust posters, so that kind of explains seizure first aid and safety in a really short way, the My ID coupons, and the seizure first aid and safety